afternoon. How are you today?
Good, how are you?
Doing good. So my name's Tyler. I'm a student physical therapist, and I'm just gonna take you through your evaluation today. Okay.
Yeah.
So first, before we get started, I just want you to give me your name for me, please.
Elliot Tiki,
And your date of birth.
09/13/2009.
Okay. And throughout the examination process, there will be some hands-on stuff going on. So I just want to make sure that I have your consent to continue before we get started.
Okay.
Okay. You're good with that?
Yep.
Awesome. So, you can go ahead and get out this shoe while we talk a little bit. Sock and shoe on this side. And just tell me a little bit about what's going on.
So this right ankle, I was running. I play football from high school. So I was running and I was trying to score a touchdown, and the guy was coming and I was trying to like cut. And as I was cutting, I felt like my ankle kind of gave out a little bit, and then I fell. Like, I just felt like my ankle did one of these things. And
So it went out like this?
Yeah. So then, I just fell. Try to tie my cleats a little harder. They taped it, sidelines, and it was fine. But the next day, I started feeling like pain. Or that same night, I started feeling pain. So I iced it.
So you played on it after you rolled it?
No, I didn't.
Okay.
I was trying to walk on it, I couldn't.
Okay.
So it's just went home, iced it, and yeah, it still hurts. I don't put weight on it anymore. I use crutches from my older brother. He had crutches, and it happened on Friday night, so a couple days ago. And I was just trying. I want to see what's, if it's bad or not.
So,
you take my sock off?
yeah, you can go ahead and take your sock off. And after you take your sock off, I want you to show me exactly where it's hurting. And have you ever had any issues on this ankle? Have you ever sprained it before or done anything like that?
Like maybe small stuff that I don't like. But here, I messed up my ankle before.
So you've done your left, but not your right as much?
Yeah, so it's like hurting like in this area.
Okay. So I'm just gonna touch it and tell me when you feel a little bit of pressure.
Yeah, right there.
And it feels uncomfortable?
Yeah.
Okay. Unbearable, just very uncomfortable, or?
It's just unbearable. I don't know. It just hurts a little bit.
Okay.
But like when I'm not doing anything, it's fine. It's just putting weight on it.
All right. Okay. So, you said when you're putting weight on it, it hurts a little bit. How would you rate that on a scale 0 to 10? 0 being no pain at all, 10 being we need to go to the hospital right now. I can't take it anymore.
The worst is like a 7.
Worst is like a 7. Okay, and that's when you're putting weight on it.
Yeah.
Okay.
Actually, I would say like a 10. Really, it felt like. Yeah, but.
Well, how is it right now?
Like a 6.
6. Okay. Okay. All right. So, do want to ask you a couple questions before you get going. Before we get going with any tests, if that's okay. Do you have any numbness or tingling in the area?
Not really.
Not really.
It's just a little bit of tingling.
A little bit of tingling.
Yeah,
Okay.
but that's really it.
Okay. What about living situations? Do you live in a house, an apartment?
I live at home with my parents.
At home. It's a house.
Yes.
Any stairs?
Yes, but my room's downstairs.
Okay, so you don't have any issues going up them because you don't need to. And any allergies that I should be aware of?
No.
Nothing. Any medications that you're currently on?
No.
Okay. Any prior surgeries to anything that you've ever had? Not even for your ankles?
Not my ankles. I had a rotator cuff surgery like 3 years ago.
Okay. And do you currently have any imaging done on that ankle?
No. I was trying to see physical therapy first.
Okay. Yeah, I figured it was a quick turnaround, but I just wanted to ask to make sure. All right. Just last thing, tell me what you're looking for out of physical therapy, kind of what the goal is.
I want to get better. Like I want to be able to run on it. I want to go back playing football. It's my senior year, so
Okay.
I'm just trying to play college ball.
All right, well, let's get to looking at it and see what we have going on. But you did say that you had a little numbness tingling. I want to do one quick test on you. It should be quick and easy. We're going to knock it out. I'm going to kind of do what we call a sharp roll test. I'm going to show you what it feels like on this side. We have 2 objects. This is going to be our goal, which is the Kleenex that we crumpled up, and then the tip of my pencil is going to be sharp. So put that on there, feel sharp. I just want you to tell me sharp or go when I place an object on your skin, okay? So I'm gonna do it on this side real quick first. If you wanna put your pants leg up, just ever so slightly right there is fine. And then look away from me that way. Okay.
Dull. Sharp. Dull. Sharp.
Okay, so you kinda get the gist of how we're doing things, okay? I'm gonna just check it on this side. So what I want you to do is look to the other side. And you can close your eyes if you would, and then I'm just gonna go ahead with this.
Sharp. Dull. Sharp. 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 Sharp.
Okay. All right, so now we're gonna do a reflex. All right, you can go ahead and take this foot off real quick for me. Okay, there we go. Got a little one there, so we're looking good there. So you've done well for those so far. All right, so now I just want to do a little, we're going to look at some range of motion stuff real quick, and we're going to look at some, just kind of like some growth strength and see where we're at. If you're feeling any pain throughout any of this, just let me know. You can go ahead and get out of that sock and shoe as well for me if you would. Yep, if you're feeling any pain, just let me know, and we'll go from there, okay? All right, first thing I want you to do, we're just going to go through ranges of motion. I want you to bring this right leg up.
This one?
Yep, I'm gonna mirror, I'm gonna do my left, your right. Now we're gonna go on the opposite side. Good. Now we're gonna kick our leg out. Good. Kick it all the way back. Good. Now do that on the other side for me. Kick it all the way out. Kick it all the way back. Okay, good. I want you to bring the leg out like this. Now bring it all the way in. Now on the opposite side. Good. Okay. Alright, good. Now we're gonna take our feet. We can do both of these at the same time if we want, or we can do it at one at a time. We're gonna bring them up, take our feet off of the gas pedals. Is that one causing any pain on your right side at all?
Yeah, a little bit.
Okay. We're gonna press down a little bit. How's that feel?
I can go further over this side.
Yeah, you can. Okay, now I want you to scoop in like we're going for some ice cream. I know that's probably gonna be a little tender on that
Yeah,
side.
it hurts.
Okay, now take the ice cream scoop out like that. Okay. Alright, so I noticed you're having a little difficulty over here. As far as the pain scale goes, how would you rate that?
When I had to scoop the ice cream, I would say like an 8. And then the other way, it's like a 6.
On everything else?
Yeah.
Okay, so. Okay. Now we're just gonna check some strength on those, so go ahead and lift your leg up for me. Go ahead and push down. Okay, do it on this side for me. Go ahead and push down. You're good. Bring your leg out like this. Go ahead and push down. Bring it like this. Go ahead and push down. Okay. We're gonna do the same thing right here. Go ahead and push down. Go ahead and push down. Okay. Go ahead and squeeze your legs together. Okay. Go ahead and squeeze your legs out. Okay. All right. I want you to not let me push you in. I'm going to push the other way. Okay. Same thing on this side. Okay. Okay. All right. Now bring your leg out for me. Bring the foot up like we're taking it off the gas pedal. I'm gonna just see, okay? Are you okay with this so far? Don't let me push down. Okay. Keep it right here. Don't let me push you up. Doing all right with these? Got just a little pain?
Yeah.
Okay, right here. Don't let me push you in. Okay. All right. Don't let me push you down. A little weakness involved, a little pain as well, I assume. Okay. Just want to check them on this leg just to see. Don't let me push down. Don't let me push up. Don't let me push in. Don't let me push out. Much stronger on this side. Okay. Alright, good. So, when we were doing the strength stuff, how were you feeling on that same pain scale we've been doing?
It's like a 6 for everything. I just feel like weaker because of the pain than just like.
Right.
Yeah.
Okay. Alright, so I want to take you through a couple of tests. You can lay on the back for me. And I want want your feet hanging off of the edge of this table. Good. I'm gonna lift this table up a little bit. So these are going to be some quick rapid motions. I'm going to kind of show you what it would feel like before I do the motion, just so you can kind of feel for it, but they may cause a little pain. Just let me know how much it does, okay, and we'll go from there, all right? So we're just bringing your foot in like that. No, that's probably not. Okay, this one. How'd that feel? Okay, all right, you can relax. Now I want you to bring this leg up like you're doing on this side. Okay. This one also is going to be a quick motion, okay? And last one. So that one's actually pretty solid. The other two had a little excess movement. How was the pain? Which one caused the most pain? Because I did see your face.
Pushing the weight.
This way when I'm pushing towards you?
Towards me, yeah.
Okay, and how would you rate that pain?
6.
Okay. All right. So the last thing I want to do before we talk, for a little while, I just want to check some joint mobility, and then we'll be good to go, and we'll talk a little bit about what's next. Okay. All right. So what I want you to do, I'm going to check a couple things. Normally I would check both sides, and that's the same thing for the majority of these tests, but today due to time constraints, I'm not able to. Want to bring this leg out for me? Okay. All right. So I'm gonna go right here, and just let me know how you feel with these. Sound okay? You can scoot a little bit closer to me if you would. I'll just check that one. And just let me know if you're feeling any pain with this one. Okay. You can go up and bend this leg. I'm going to do one more set of them. And then we should be good. How's that feel?
A little weird.
These are very similar to the test we just did. So how would you rate the pain on those that we just had?
Probably 7.
7?
Mm-hmm.
All right. So you can relax and put your shoes and socks back on. And we're just going to talk a little bit. I'm going to take him through some crutch education, as well as talk to him about maybe some Therex that he can get started on and his results that we've done today. So that'll be it.